Yeah, so just to say that we're all here as obviously representing our individual services, but more importantly, what we want to try and sort of convey today is how we are working together to provide a response to children and young people. So that's whether, wherever they are on their particular journey, individual journey, from maybe just starting to struggle with the mental health right through to requiring more intensive and specialist support. So yes, as Julie said, we're here first and foremost to listen to your views and experience and really understand how we can start to improve services, how people access services, but also how we communicate our offer to people so that they can be informed and make those informed choices for theirs and their children or the people that they care for lives. So just a little bit of background, and I've not got long, but if anybody is interested, we did have a system-wide review of children and young people's mental health services across Bradford District and Craven. And sorry, was that a comment about the sound? Is it all right? Can you hear me? Just saw something flash up anyway. Let me know if you can.
It's all right, it's fine.
Okay. Yeah, so the system-wide review is commissioned by Bradford Council, the Bradford District Care Trust and the CCG. And really that was about what is the current state of mental health services for children and young people. And from that review, there were quite a number of recommendations on how we could improve things locally. There were also recommendations in the Children's Services Improvement Plan, which came out of the Ofsted inspection, which are around mental health and things that we've committed to do. And in addition, the plan that we've been working for since 2015 is Future in Mind, and that was our implementation plan and really the guiding principles that we still work to today. But importantly, with Future in Mind, when it came in, there was some additional investment for services. And in Bradford and Craven, we used quite a lot of that money to commission within the voluntary sector. So what we have in Bradford is quite a kind of vibrant market in terms of children and young people's mental health, and it's not all just invested in what people consider to be our specialist CAM services. So that's the background. Last year we became one of the Actors One programmes, so that was really around saying that we've got these challenges, we've got these issues, we've got these positive things, but we need to work together to move forward on them. So the Actors One programme brings everyone together across all our system partners to work together, health, social care and education, to make things better for children and young people. And as part of that programme, we agreed 4 work streams, and those were around crisis support, how Thrive and One Trusted Pathway. I'll come on to Thrive next. So that's about how people access and navigate our services, models of care in terms of what types of services we've got, are they in the right locations, are they what children and young people need, and prevention, how can we prevent mental health issues from arising and how can we intervene early when they do. In terms of our programme, we have this year we've got 8 Healthy Minds apprentices. So these are young people that really bring that young person's voice into our decision-making structures as part of our leadership team. And we've also, so there's 6 apprentices that are working specifically on mental health, and there's 2 that are working on the SEND agenda, so they're bringing their experience to that. I had hoped for 2 of them to be here today, but unfortunately they're out in schools delivering a programme this morning. Okay, next slide. So this is the Thrive framework, and it's a national framework, and it's a way to really understand how we should deliver children and young people's mental health services. And it's really, sorry, I'm just looking at, I have to read this part. So it's an integrated, person-centred and needs-led approach to delivering mental health services for children and young people and those families that are supporting them. And what we're trying to do in Bradford and Craven now is map our existing services across this Thrive framework so that people have a clear understanding that if they need advice, there's these services that they can approach. If they need some more help, then there's these particular services that they can approach. So it as we're here today, you'll note that some of our colleagues will represent each of these different quadrants of the Thrive framework. So we've got Olivia, who's going to talk about Kooth, and that comes into our, Kooth is our digital offer, and that comes into our getting advice. So where can people go when they just need a bit of advice and signposting, along through to getting help, which is more about setting goals and looking at how you can get support to achieve those goals around maintaining and improving your mental health. So we've got Charlotte from Youth in Mind and Lisa from our mental health support teams, which are a new brilliant offer that we've got locally. And then Jenny's here from our specialist services, which are our CAM services, which really work mainly within that getting more help quadrant of the Thrive framework, and also some into the risk support, so some of the crisis support for children and young people. There's a really big circle in the middle, which is about thriving, and what we anticipate is around, I think it's just over 80% of our children and young people population will fall within this section, and that's children that just need universal services to maintain their mental health. So that's services that are delivered within schools, you know, the nurturing environments within the school for children, but also some of the work that our apprentices are doing around the kindness, compassion and understanding campaign, and they're out delivering in schools. So that's a bit of a whistle-stop tour really, but we're happy to talk through because we've got some time to talk later on. Thank you.